So this is about clients with religious and sexual identities and the implications this has on social workers. So first, some definitions. LGBTQ is the lesbian, gay, bisexual, and queer community or identity. I am not talking about transgender individuals today because many religions do not explicitly talk about gender identities. Religion is organized worship, and spirituality is more individual in how one connects with God or nature or others. Identity goes through 3 stages. First is identity formation and confusion, where individuals discover who they really are. That can lead to either positive identity acceptance, where you feel good about yourself, or negative identity acceptance, which is exactly the opposite. You're filled with shame or guilt or doubt. And eventually you will have identity integration, in which you immerse yourself in the community and culture of the identity that you are embracing. Individuals can ebb and flow between these stages based on the social support or lack thereof that causes them to either positively or negatively accept their identity. The LGBTQ and religious communities are often in conflict with each other. A lot of religious communities preach that homosexuality is a sin, and a lot of the LGBTQ individuals also reject religious individuals because they have that homonegativity. There are some negative consequences of identifying as both LGBTQ and religious, and most of these stem from the internalization of the homonegativity preached to them. This can include depression, anxiety, suicide ideation, self-harm and self-doubt, feelings of worthlessness, and negative body image. Individuals can also delay their sexuality until much later in life because of internalized religious guilt from same-sex behaviors and identities. They can also try to segregate their 2 identities and only focus on one or the other depending on what environment they are in. Sometimes individuals are forced to exile their church communities or their families, which can lead to feelings of intense loneliness and isolation. And this grief and loss is similar to that felt by the death of a loved one or very close family member. The severing of these ties can last years, well into adulthood. Additionally, those that come out in supportive church environments have increased psychological well-being, including increased life satisfaction and decreased depression. This may be due to increased spirituality and existentialism as opposed to the actual religion. And there are also decreased behavioral health risks for these individuals, such as a decreased risk for HIV, substance abuse, and alcoholism. And all of these things are prevalent in the LGBTQ community, but it seems that having a supportive religious environment may help decrease the risk for the psychological and health risks. So some positive results of coming out LGBTQ for religious individuals is an increased sense of spirituality. They can also incorporate their religious morals and values that they have learned in the past into their present spiritual and LGBTQ community and way of life. And many also feel an increased self-confidence and open-mindedness when faced with non-affirming environments and when they form their identity in these environments. So social workers should know that about 80% of religious LGBTQ individuals do want to integrate their religious and sexual identities. Coming out can lead to trauma, especially grief and loss. Social workers should be aware of that. There can also be a possible delay of sexuality, the comorbid psychological issues, and in addition, social workers should have a basic understanding of religion, spirituality, the impact on their daily life, and how to parse out their own personal belief systems when working with these individuals. Social workers should be able to direct clients to affirming communities, and that's both religious communities that accept LGBTQ individuals and LGBTQ communities that accept those of religious or spiritual identities. Social workers can also encourage spiritual engagement outside of religious institutions and let people know that they can engage in social activism, volunteer work, and other things that can help them feel a connection with others. Social workers should be able to understand the grief and loss that LGBTQ individuals can experience, and if willing, they should be able to participate in family counseling for families that are very religious. They don't need to reinterpret their teachings, but just be able to change their attitudes and behaviors toward their LGBTQ family member. Thank you.